Key industry leaders are stepping up and shepherding healthcare organizations that are seeking new and innovative ways to engage patients and drive better outcomes. Our next guest, Will Johnson, is at the forefront of this revolution as Vice President and General Manager of +Oscar. With a background in healthcare strategy and a passion for solving consumer pain points, Will leads the charge in commercializing innovative tech solutions for providers and payers. Drawing from his extensive experience at Oscar Health Insurance, Will brings a unique perspective on leveraging technology to improve healthcare outcomes. While together, Will and I discuss how +Oscar's Campaign Builder is revolutionizing patient communication, driving better utilization, and ultimately creating healthier, happier populations. Join us to gain Will's insights on the future of personalized healthcare and how technology can empower both providers and patients in this rapidly evolving landscape. Let's go.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us.
Hi, Will. A warm welcome to our podcast today.
Thanks, Mike. Appreciate you having me.
Well, given your passion to help healthcare organizations democratize knowledge, increase interoperability, accelerate discovery, and enable true personalization in healthcare offerings, I'm looking forward to this exciting conversation today. But before we dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast so you will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli on Apple Podcasts, Spotify, or wherever you listen to your podcasts. Lastly, please visit the bottom of the episode notes to connect with me on LinkedIn and Twitter in order to further the conversations occurring on this podcast. All right, Will, it's almost time for our community to learn how you and the +Oscar team are leveraging the power of personalized data to deliver dynamic, HIPAA-compliant interventions via omnichannel messaging to drive business outcomes for healthcare organizations. But first, what's that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
Yeah, in some ways, I'd just say go seek out painful or otherwise cumbersome experiences on behalf of patients and members. You know, I think for us, one of the things we did, even in Oscar's earliest days, try to take what was considered at that point, at least, a uniquely consumer-centric approach to solving problems and, you know, frankly, guiding members through a very complex healthcare journey at the individual level. And I encourage anybody else to kind of take the same framework to solving problems, building businesses or otherwise, trying to support their own organization and the populations that, you know, have given them the opportunity to serve them.
Well, let's build on that. I love this advice because if we're going to move the healthcare industry forward, we got to go after the big boulders that stand in our way, those big, hairy, audacious problems. Will, how important is it? And maybe you guys did this at Oscar, now at +Oscar as well. Sure, you want to go after those big, big, hairy, audacious problems, but how important is it too to get out there and hear from those end users, whoever they may be, to hear? We can always think and sit in our offices in our glass houses and pontificate that this is going to be the best solution ever if we just get it out in the marketplace. And then we see a lot of times that falls flat when we build in vacuum. So if we're going to go out there and try to solve big problems, also, how important is it to get out on the street, boots on the ground, and talk to those end users to help solve those big problems?
In a word, critical. You know, I think we've now got an EVP of +Oscar. Her name's Carrie Sane. She talks about this notion of being, you know, outside in, which is effectively saying, look, like at the end of the day, you got to listen to what the customer wants. And oftentimes the best way to go figure that out is to just get out of your seat and go talk to them. Whether that be, you know, in a B2B space like we are, and really we're kind of B2B2C, it's going to talk to these organizations that service, you know, oftentimes very complex, nuanced populations with respect to the challenges they deal with, whether it's language, where they live, rural, urban, etc. And even if you think of the clients we service today, you know, those populations look vastly different from client to client. And so I think it's easy to sit there and, you know, frankly, pontificate and become perhaps overly academic with respect to what you need to build to solve problems. I think the much more effective way to do it is to understand the basic incentives and kind of like business governing frameworks that drive value for the organizations, and then go talk to them about the unique problems they have engaging their populations, or speak with those populations directly. I think we certainly did that in the early days of Oscar. My old boss, my first boss actually, and I, when we first were launching Texas, this was like 2015, used to joke that we sure were part business operators, but also equal parts anthropologists. And I think I've tried to take some of those principles over to the Plus Oscar side as well. And very much in partnership with Carrie and the team, kind of instill those in our DNA. I'd love it if our clients were to say the same about us. There's no greater compliment for at least myself and our organization than somebody saying we're relentlessly customer and end consumer focused.
Well, we're going to discuss all of that. And thank you for sharing that, Will. Very, very critical pieces of advice and insight for especially our aspiring entrepreneurs and tech founders here on the podcast. We're going to discuss exactly how you guys are going about all of that and more at Plus Oscar after we get back from thanking our community champion sponsor.
Healthcare faces a paradox that echoes through generations. While the current practices that help heal patients today are vital, it is crucial to evaluate them through an environmental lens. OSHA's Responsible for Tomorrow initiative is a collection of interviews featuring influential thought leaders and industry experts like you who share their sustainability strategies, insights, and provide valuable perspectives from diverse industries to inspire innovation within the healthcare sector. OSHA invites you to join this journey. Want to share your sustainability story? OSHA is actively looking for partners to highlight the important and inspiring work being done around the globe. Check out OSHA's Responsible for Tomorrow initiative and series at OSHA.com. That's OSSUR.com. Or visit the episode notes and click on their link. Together, and with OSHA helping lead the way, let's all be responsible for tomorrow.
All right, we're back with Will Johnson, Vice President and General Manager of Plus Oscar. Will, thank you so much. Really set the framework up for today's conversation on the front end of this podcast. Thank you for that. We got to get after some big, big problems in healthcare. There's a lot of them, and there's a lot that can be solved to really help move this industry forward. Love what you guys have been doing at Oscar. Can't wait to hear more about Plus Oscar and what you're leading there. But first, of course, Will, we got to take it back into the time machine a bit of how this all came to be in the first place. Hey, just as a quick aside for our audience, you and I, both former college athletes. So typically 2 athletes on one podcast at one time. We'll see where this thing goes. I can't predict how it's going to end, but you know what? We'll see where it takes us. Will, jokes aside, love to hear a little bit about that journey that led you into the Oscar family and now helping lead Plus Oscar. And of course, we got to ask, what are you seeing on the horizon? You know, as well as I do, we're seeing a lot of change come at us very, very quickly, not only for our own organizations on the tech side of the house, but really for all the folks that we end up serving on the other side. And then, of course, always love to ask how we can be helping you as well. But Will, let's get in the time machine. Take us back a bit. How the heck did you get into healthcare? How did you find a home at Oscar? How did Plus Oscar come to be? Give us a little bit of that inside scoop.
Yeah, so it was an interesting journey. As you mentioned, former college athlete and wanted to do something on a post-collegiate basis that was still pretty team-oriented. So for me, consulting seemed like a natural kind of exit after being in team constructs for really my whole life. I spent most of my time in tech and telecom. And then my last case when I was doing the consulting gig was with a large hospital system in Franklin, Tennessee. Wanted nothing to do with healthcare at the time. I was like, oh man, I just want to get through this case and go back to tech. It'll be a lot more fun. But interestingly enough, during that case, I actually had a horrible healthcare experience myself. Went to multiple emergency rooms. At some point, if anybody ever sees me in the wild, you can ask me to pull up a picture of what I looked like in the ER, but it was quite a mess. And one of the things that became just quite acutely apparent for me was just how alone most consumers are with respect to navigating a fairly complex healthcare system and a mental state that is anything but sane, right? Like most people that are going to multiple emergency rooms aren't exactly as level-headed, and in some ways are kind of like philosophically drowning. Like you'll take anything that'll hold you up, right? So even just a little nudge or a little bit of support from anybody is really helpful in times, where you're very vulnerable as an individual. With that said, as I thought about my experience retrospectively, the thing that kind of traveled with me was the insurance card. All the individual doctors were largely pretty siloed during that broader longitudinal episode. Multiple emergency rooms. Most folks were doing the best they could just to take care of me, but then they kind of shipped me off to somebody else. Whereas the insurance card was the only thing that seemed to travel with me. And in theory, should have had my data, been able to be a bit more of a partner with me through that journey. But at the time, it just didn't function that way. And so I actually, shortly after my last discharge on emergency room visit number 3, started looking up interesting insurers in the space that were taking a more member-centric approach. And Oscar actually came up. At the time, I was in Texas and wanted to stay there, so I kind of wrote them off. But then 4 weeks later, I got a cold LinkedIn message never forget it for the rest of my life. It said something to the effect of, hey, look, we're launching this Texas market. This was like late 2015 at the time. Would you want to help be one of the first boots on the ground to go stand this thing up and really be the first market outside of New York and New Jersey that Oscar entered? They were entering Texas and California at the time. And, kind of looked at the LinkedIn message and said, this is probably fate. Let's take a shot at this thing. And that's how I got to Oscar. So in some ways, the thing that brought me to Oscar was this member or patient or consumer centric, deeply passionate approach to solving the challenges of the end consumer is what attracted me so much to the Plus Oscar opportunity, right? I spent 7 years over on the insurance side, growing that business, managing some of the state level P&Ls and supporting some of our value-based care strategy and execution. But when the opportunity to move over to Plus Oscar came along to help commercialize what I would describe as the real reason I joined the company to begin with, which is the core engagement and member centricity chassis, it was kind of a no-brainer, right? And the ability to take that and give it to others from a just mission perspective was quite appealing to me. It's been nice to see us, over the past roughly year to year and a half, get roughly 500,000 lives on that platform, bring on a seasoned leader like Carrie's saying, in combination with, of course, a confluence of others that support this business on, the tech, data, and business operations components has been really exciting. So I don't know if that's a helpful overview, but it's been a fun journey to say the least.
Absolutely. And thanks for setting the stage. That's incredible. You're right. Sometimes you just never know what LinkedIn messages are going to turn into what. You don't. Hey, that's why you answer them sometimes. And here you are, Will. I love it.
I'm going on 9 years, man. Wow. I'm going on 9 years after one LinkedIn message. So
unbelievable.
Clearly, you got no idea.
It's unicorn status in and of itself.
I guess so.
Let's go back before, I ask who exactly is Plus Oscar. We're going to go there in just a moment, but let's go back a little bit as well. One thing that, and we talked about on the front end, we want to understand from the end consumer, an end user, whoever that is, what the true need is, what is the pain point. With that kind of premise set for the question, when did you as a team on the Oscar side start seeing the signals in the marketplace? We need to launch this Plus Oscar part of the business. What was happening in the marketplace and why? What were some of those dynamic forces that started to get you guys to think we got to launch that?
Yeah. So, I think there were a passionate group of champions early on that built the Campaign Builder product. And I'll speak about that product specifically since that's what I'm spending most of my time on, that thought that there was an application well beyond just the use of the platform for the Oscar insurance business, because it was fairly modular in nature. And, if you think about the applicability for an engagement platform, in theory, both provider and payer could use it on an equivalent basis. Where I saw this most prominently was when I was in South Florida and I was talking to some of our providers that were managing to value in some capacity, one of which is actually now a customer. But they would ask me, hey, what would it take for us to be able to leverage Oscar's engagement capabilities for our business? Because I think one of the things I was seeing and they were seeing as well is as the populations they were managing were getting increasingly diverse and complex from a conditions perspective, engaging them became quite difficult in a way that was appropriate and personalized for the members and that was scalable for the operations of the business, right? Like their engagement strategy previously might have been sending a bunch of text or like they've got a call center in, Bogota, Colombia. But like neither of those two things kind of check the box for deeply personalized and eloquent from a longitudinal journey perspective or scalable, right? You can't just throw more call center bodies, at issues at a certain point. And so I think for me, hearing those in potential customers asking about it got me quite excited to move over to the Plus Oscar side and launch the business. So in some ways, like it was very outside in from a demand perspective. Interestingly, like I said, some of those same folks who were asking me about it are now customers having great results. So it's been nice to see that kind of come full circle. But similarly to my initial opener, we took a pretty outside-in approach to deciding whether to launch this thing. Now, of course, we've got payers and providers on the platform, but for me in particular, I saw the power of it for the Oscar insurance consumer, but also just heard the demand myself firsthand.
Absolutely love it. Of course, it's obviously playing out. You guys are making some great strides quickly within the marketplace. So let's talk about those strides. Let's talk about the impact you guys are having with Plus Oscar. Let's first go there. Will, who is Plus Oscar?
So effectively, Plus Oscar is the technology and services division within Oscar Health. So if you think about Oscar Health now as the parent company, we now have two discrete businesses. And we just came out of an investor day. So, all of this, I think, which is great, is now public. One of those businesses is an insurance company with, 1.4 million plus members strong, largely focused on the individual market, so the ACA market. and of course, the emerging ICHRA space. On the other side of our house is the +Oscar business, which is where I now reside. We've got roughly 500,000 lives on the engagement platform. And, we've got a couple of goals, one of which is to continue to grow Campaign Builder. And the second is also to commercialize, more technology and services as a part of a broader +Oscar business. So I think both of those are getting a lot of attention in our time. I'm very much focused on kind of number one and working with payer and provider prospects to help, commercialize that core engagement technology and bring what I would call behavior change vehicles to those prospects and ultimately clients to support the populations that they manage and the communities in which they reside.
And so when we're also thinking about it more broadly, Will, and thank you for setting the stage on the +Oscar side, when we think about it more broadly, some questions come to mind, and I'll toss it at you. What digital tools will impact the future of healthcare, science, clinical practice? What are you seeing? What are some of those digital tools that we need to be thinking about from your perspective?
One of the things I used to talk about all the time, even before I joined +Oscar, particularly with providers or for those that are managing to value in some capacity with, difficult to engage consumers. Think like Medicaid, ACA, dual eligibles. Engagement is an offensive sport. In some ways, there's no one size fits all model. And so I think the platforms that will win and the organizations that adopt those platforms understand that engagement is kind of a nuanced thing. You can't just throw a bunch of text at folks. You can't just have a couple languages. Oftentimes, you need uniquely personalized communications and interventions to deliver the clinical pathways, member experience, kind of life cycle that your organization desires, which if done appropriately, both improves the NPS of the populations you serve, but also your own P&L. So I think to put it perhaps a little bit long-winded, that's how I would articulate it. And I would encourage every organization to think about it the same way.
And you started talking about, NPS scores and all of that. Of course, that is really from outside of healthcare, very a consumer-centric mindset, which is great. And of course, we should start, if folks haven't already, need to be thinking about that inside of healthcare as well. And so, Will, when we start thinking about the U.S. healthcare industry and our shift towards a more consumerized type of model and a digital and value-driven system, how has that been going? Where are we? How do you feel, especially being in the Oscar camp now, +Oscar camp for so long? Where are we? Give us a pulse check of where we are.
Yeah. So, I think more broadly, and, our CEO speaks about this frequently, the market's only going to get more individualized. And I think as you see more individual consumer behavior, you will see more individualized demand. So organizations are going to have to meet that. And the only way I think you can is through uniquely personalized experiences with platforms that can support those. So I think +Oscar, given our relatively robust history of doing this, and by this, I mean engaging difficult to reach populations across, large national footprint on the Oscar insurance side, we're pretty uniquely positioned to, I think, kind of ride that wave because there's a few broader trends I think are going on that help us. I think individualization is one of them. I think the second, though, is you're seeing a relatively larger percentage of that total population be in government-funded lines of business, right? Which is kind of where the platform grew up. We have experience with those populations, and I think we can support those that endeavor to manage their own. And then I think the third piece is, frankly, regulation has not been kind to anybody in the healthcare space more recently. If you think about V28, STARS methodology changes, et cetera, every 12 to 18 months, the organizations that we work with or aspire to work with have gone through a fairly broad P&L upending regulatory change. I think all of them probably nod an agreement has been fairly material, either on their bottom line or internal ops or both. And so I think for us, we're uniquely positioned to give organizations the ability to, as I like to joke internally, now actually manage medical costs. The only way you can do that appropriately from my perspective, beyond just your own internal operations, managing your network, et cetera, is to build longitudinal, personalized journeys for these populations that kind of check off the right steps across a given plan year, whether it's closing gaps in care, adhering to the medications that you're on, et cetera. That's where I think the value is going to be derived. And, I think the good news is this is now not a unique thought. There's plenty of sharper folks than me in the industry talking about this. But, as I like to say internally, we're finally back to a place where actually managing medical costs is where all of the alpha is going to come from, as opposed to, just building giant risk adjustment farms and call centers that ultimately call their way to profitability. I think that is just not going to be a strategy moving forward. So we're, I think, relatively well positioned for organizations that, want to go on that journey. And for those that, have a consumer-centric, aspiration, but perhaps lack the platforms to do so.
And for those groups that you call customers, those end users, what has the journey been like for them? What's that feedback you have been receiving? Because you know as well as I do, it doesn't matter what we think about our products or services. It's the folks at the end users on the other side of the aisle that are using the product and services that matter the most. What's the feedback been like for you and the team?
Yeah, I think the good news is the numbers speak. So, on one hand, the feedback from our current client base has been quite strong. What is even better is the numbers seem to back that up. So for us, a lot of the core metrics that we're chasing are probably not surprising, right? Retention, driving annual wellness visits, closing gaps in care, etc. And we're now at a place where we're actually seeing kind of the fruits of our early labors. One of our clients is a primary care group in MSO. We've now actually got like a 4-month year-over-year view that says last year, during the first 4 months before they had the platform installed, what type of change from a metrics perspective are they seeing in the first 4 months of this year when they had the platform installed? So, one of those metrics we looked at was annual wellness visits per 1,000 patients. Those are up 118% year over year during the same time horizon, which is great to see. One of the Medicare Advantage plans we work with experienced a 96% retention within the population that we engage for that MA book. So we're seeing all the right metrics with respect to, are you delivering value to these partners both on a year over year basis and on a single metric basis, which is great to see. You like it if your folks that you're working with are saying, hey, we enjoy working with you. But I think it's just one step better when you could say, I'm glad that you're happy, and looks like your metrics also back that up. So it's been great to see that. And also just, frankly, I think helped to prove the thesis that the platform can work just as well, for others as it does for Oscar Insurance.
Love it. Thank you so much for that, Will. Now let's get the crystal ball off the shelf for a bit here. Let's look a little future state. What are you seeing as a leader in the captain's chair that you're in on the macro of where we are heading, where we should be heading? And then, of course, where is Plus Oscar going to be in that future state as well? Let's look, 2 to 3, 3 to 5 years. How are things looking for everything?
Oh, man. Crystal ball is not necessarily the business that I'm in, but happy to give my perspective, even if it's not necessarily unique. So in some ways, at least in terms of where like the focus is going to be, I do think between, V28, STARS methodology changes, et cetera, all the things I just laid out, this notion of actually kind of buckling down and managing medical costs of the communities that, any of our partners or prospective partners service is going to be the guiding light. And I think, as you think about where the business is going, whether you're a value-based focused provider, or a payer, like that's going to be a core tenet or pillar. Much like I said, I think the market's going to continue to be more individualized. So if I think about the 2, 4, and 5 year vision out, the things we're thinking about for Plus Oscar is how we best position ourselves for that individualized future. I think Campaign Builder and what we're doing on the engagement automation side is a core driver of that strategy, because as the individualized segments grow, the platforms that can personalize and uniquely communicate with the end individual at a near end of one level, I think are going to capture significant value. And so for us, if you believe that trend of individualization, being a company that's got great tooling to manage the individuals in a given population for a payer or a value-based provider puts us in a pretty good spot. Beyond that, you'll have to talk to our CEO, Mark and Carrie. My focus right now is finitely on building for that individualized future and how to engage them.
Well, fair enough, Will. We'll put the crystal ball quickly back on the shelf. You did a great job nonetheless with said crystal ball, but do appreciate that kind of look into a little bit of the future state. And it's just, these are the realities. This is coming, whether the industry likes it or not. Better get ready for it, buckle up, because this is what the next generation is demanding of us. We better answer the call. So obviously, you guys are very well positioned in that environment. Let's bring it back to future state, Will. Let's talk about how this amazing community rallied around our podcast can be helping you and the Plus Oscar team. What's one problem, need, or question that you and the team have that our community can be helping you with?
Yeah, I think it's probably less of a specific problem and more just a call to action or area of interest. If you've got organizations that, have an interest in patient or member engagement and really believe that lots of the value creation is going to come from best-in-class engagement in the future, give us a call. I'm obviously selfishly in a very growth-oriented seat, but for us, I think that the single thing we can be doing to satisfy the mission of Plus Oscar, which is bringing the consumer-centric technology and infrastructure that we originally built for the insurance company to others, it's to talk to more folks that have a similar worldview. Beyond that, if you ever want to just nerd out on anything healthcare related, feel free to give me a shout as well. But as it relates to Plus O, that's the single thing that I think we could, use support from the community from. That's just talking to interested folks, that have the same calling that we do.
Love it. How do they track you down, Will? Social media handles, websites, or otherwise? How do they get a hold of you?
Hey, you can shoot me an email or honestly, give me a call. So my email is wjohnson@hioscar.com. That's HIOSCAR.com. Or, look, you can probably have my cell phone number down from somebody. I won't give it out on the show for obvious reasons, but feel free to shoot me a note or find me on LinkedIn. We'll be sure to connect.
Easy enough. And for our listening community, just simply scroll on down to the episode notes with your favorite podcast player to find those contact points for Will and the Plus Oscar team. Also, you can head over to our free global online community at passionatepioneers.com. There will be a post for Will's episode where you can leave comments, feedback, suggestions, or otherwise, and find those contact points online, again, over at passionatepioneers.com. Will, we're going to wind this down because I know you have a lot of trouble to go and cause with your team. A lot of good trouble, that is, of course. But before we get you out of here, we got one more piece for you. It's a fill in the blank. I'm a passionate pioneer because
I had pain myself, and there is no greater driver in ambition or mission than experiencing pain yourself and wanting to go solve that for others. So, I would encourage anyone to seek out the problems they deal with every day as mechanisms to be entrepreneurial, make the world a better place, particularly as it relates to healthcare, because we sure need it.
Will, thank you for taking the time to get together today, sharing your journey, sharing what all the good things happening in the Plus Oscar camp. Really appreciate you being part of today's episode and spending time with our community. But for now, thanks again, Will. We appreciate your time.
You got it. Thanks for having me, Mike.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.